Hello everyone, welcome to sqadia.com, and in this section we will go over the management and treatment. So in management and treatment we will talk about mainly different options of surgery and other treatment modalities, which also include the medical therapy. So physical examination, in physical examination usually the abdominal and pelvic examination is done, and then when we do the abdominal and pelvic examination, it's important to focus on few important things: whether the growth is solid or cystic, if there is any deviation to the side, or if it's any deviation on the lateral side of any organ, any structure, that should be assessed properly. Whether the structure or mass is mobile or fixed, whether the surface of the mass is smooth or irregular, if it is associated with ascites or if ascites is present, if there is any nodules present, or if the growth rate is rapid or slow. So these are very important factors to be assessed on the pelvic and abdominal examination of the patient. Then on transvaginal sonogram, usually pattern recognition is done, which is to find out what is the pattern of the masses. So subjective evaluation of ovarian masses is done and based on pattern recognition. Usually sensitivity of this testing is 88% to 100%, and specificity is 62 to 96%. So transvaginal sonogram done to on the basis of the pattern recognition. The sensitivity and specificity can be from 88 to 100 and 62 to 96%. And also other tests that can be performed on top of the ultrasound or sonogram is the Doppler study. Doppler is done to find out the blood flow through the tissue. That also sometimes is very helpful to find out how is the blood supply or blood flow. So these are the few tests done for transvaginal sonogram. Then the Doppler evaluation. Doppler is done to find out the resistance to blood flow and how is the blood flow. In hypoxic tissue, usually Doppler evaluation is done on hypoxic tissue. Hypoxic tissue is the tissue in which the blood supply or supply of oxygen is not enough. To find out whether the blood flow is good enough, or what are the factors that are leading to or blocking the flow of the blood. So resistance to blood flow. Role of this in evaluating the ovarian mass is not very confirmed. What's the role of this? It's very controversial, the role of Doppler evaluation. Then we also do the vascular sampling of suspicious areas. In the suspicious areas include some papillary projections, solid areas, any thick septations, using 3D ultrasound and to find out whether there are any abnormalities on that or not. Usually chaotic vascular pattern is found in case of the malignancy. So chaotic. So this is the Doppler that gives you the idea about the how pulsatile. P is used for the pulsatile index. Pulsatile, how pulsatile the blood vessel is, and R is used for resistance, how obstructive it is. So pulsatile and resistance. So this Doppler is used to find out the pulsation and resistance in the blood flow of the blood vessel. Okay, so some other imaging modalities used for investigation of the benign tumors is, although it's not recommended in the initial evaluation, but CT scan, MRI, and positron emission test is also used later on for the evaluation once the disease is progressed, or if there is chances that it might become a malignant, then these tests are very important for the evaluation of the disease. Then assessment of lymph node involvement is important, and also the assessment of whether the disease or tumor is metastasized to omentum, peritoneum, or the liver. Here, hepatic metastasis, obstructive uropathy, if there is any obstruction to the urinary system or urinary output, then all this can be tested. Then usually the MRI is used for differentiating other different types of non-adnexal pelvic masses, but like myometa. But the problem is MRI is expensive and it's inconvenient to do. So usually it's not recommended MRI, CT scan until the disease is progressed, or whether if its progression to malignancy is suspected. Now, some indications for the surgery is any solid ovarian lesion. If it's present, usually the surgery is recommended. And if there is a lesion with papillary vegetation on the cyst wall, if there is vegetation or growth on the cyst wall, usually surgery is recommended. Any mass which is more than 10 centimeter in diameter usually is treated by the surgery. And palpable adnexal mass in premenopausal or postmenopausal women, usually surgery can be performed. Or if there is complication like torsion or rupture, surgery has to be performed to relieve that torsion. So these are some indications for the surgery. So here you have again Graafian follicle, ovulation, become corpus luteum, then becomes yellowish shrinkage structure, which is corpus albicans. So indications for surgery when benign tumors of ovary are present, mainly if it's solid, usually surgery is performed. If size is big enough, if female is after the reproductive age, it's better to do surgery, or if it's there, complications are present. Again, some more indications for surgery. If there is ovarian mass in the reproductive age group. We divided it into two sections depending on the size of the mass. If the size of the mass is less than 5 centimeter, or if it's more than 5 centimeter, or if it's equal to 5 centimeter. If it's less than 5 centimeter on ultrasound, then usually if it's cystic, complex, solid, suspicious, or usually surgery is done. If it's cystic, first observation, then we see if it persists or if it's progressing, then surgery is done. In case if it's more than 5 centimeter, usually always surgery is done. So if it's less than 5 centimeter, depending on whether it's cystic or solid, we decide for the surgery. But in case if it's more than 5 centimeter, surgery is always recommended. Cyst aspiration is also done, and this is the needle used for aspiration of the cyst. With the cyst, usually when we aspirate the cyst and the cells or fluid removed is usually sent for testing, and diagnostic cytology is done to find out if there is any malignancy or not. It's 25 to 82%. So sensitivity is not very good, poor sensitivity. It's not therapeutic, so it's not used as a treatment. It's only used as a diagnostic purposes. Approximately 25% of the cysts reoccur within 1 year, and aspiration of a malignant mass may induce usually spillage into the peritoneal cavity, and it can lead to seeding of the cancer cell. So aspiration sometimes can even lead to further spread of the cancerous cell, or it can lead to further spread of the cancer into the peritoneal cavity. So the only important thing why we should aspirate if it's required for the diagnostic purposes. Otherwise, there is no therapeutic purpose of this aspiration. The operative modalities is again depend on laparoscopy versus laparotomy. The decision again based on if there is suspicion of malignancy and if there is technical expertise. Usually doctors decide what type of procedure is required. Laparotomy is opening of the abdomen, and laparoscopy is insertion of the laparoscope to examine. No, usually clinical trials are available, RCT, no routine clinical trials which compare the difference between or recurrence rates following laparotomy or laparoscopy. The objective is to try cystectomy if possible. So, the purpose of laparoscopy or laparotomy is if there is cyst present and they finally decide that cyst can be removed, then cystectomy is usually done. Laparoscopic surgery for benign ovarian tumors is associated with usually less pain, shorter hospital stay, and fewer side effects. So, as compared to laparotomy, if laparoscopy is done, it has less stay in the hospital and less pain and less side effects. So if choice is depending on feasibility, laparoscopy is usually preferred nowadays. Other operative modalities is usually if laparoscopy is done for then you, at the same time examination of all the cervix or surface of the uterus and peritoneal cavity is done. If there is any evidence of the tumor, the best is to remove the tissue for biopsy, remove the cysts, remove any fibromas present. So during this, is the most priority should be avoiding the rupture of the tumor, because rupture then can lead to further complications. And usually the tumor is protected by the endoscopic bag before the removal, so rupture cannot be happen. To avoid the rupture. The medical management is analgesics, which are the painkillers. Usually combined oral contraceptives are given. Progesterone only can be used, and gonadotropic releasing hormone agonist, and then other hormonal agents are used. So medical management is there besides the surgery, which is mainly hormonal therapy, and if there is a pain, usually analgesics can be used to relieve the pain. So that was all about the management and treatment of the benign conditions of the ovary. Thank you for watching sqadia.com.